Have a medical question? Call 407-422-1212. That's 407-422-1212 or It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
Make sure it was working. Hey everybody, it's just about that time. Welcome to Stages of Life Radio. I am Melissa Fox, and the doctor is in. Now, this is part 2 of a 4-part series on...
It could be 5 parts.
It might be 5.
Let's see how fast I can talk.
All right, so here's the deal. We're talking about nutritional supplementation, and tonight we're talking about old age or middle age?
Middle age.
Middle age. Okay, so you know where we're at. Dr. Klein, Dr. David Klein from Stages of Life Medical Institute. Been around the block and back again, and here he is.
Yeah. So in any event, so what we talked about last week, and so we're going to build on this thing as if it were let's say some kind of a wall. So last week we established the foundation, which is why we have to do any nutritional supplementation at all, what it's all about, and then how do you get started? What are the basics? What are the things that most everybody, just about everybody, needs to do? This would be from maybe the age of 10 up. And this is exclusive of the typical caloric intake that you need to bring in, the essential amino acids, the essential carbohydrates, and there are such things, essential fatty acids. These are chemicals of a particular nature, type, subtype, that your body cannot manufacture, and it needs to be taken from the outside. So an essential amino acid is a chemical, an amino acid that your body can't make from another chemical or another amino acid. So what we discussed was what is the basic need. And the 2 products that we mentioned, and you can use whatever you want to achieve the same means, provided it's of quality and it doesn't contain things that you don't want, sometimes known as poisons. And so the one product is down to basics without iron. Now that without iron is very important, okay, because the addition of iron can cause problems like constipation if you don't need the iron. And most people, believe it or not, don't need additional iron in their diet. You get plenty of it. So additionally, we were going to offer up something called Heart and Soul, which is a fish oil, an omega-3 fatty acid mixture. It's good for the heart, and it comes from fish, S-O-L-E. I get to name the stuff. My sense of humor comes for free. So that's what you need up through perhaps early adulthood. But then you start to get into something kind of weird, and it's called middle age. And it occurs earlier or later in certain individuals, depending upon how, let's just say, how quickly they might age. So how fast do you age? Okay, well, one day at a time would be the right answer. However, there are people out there that do things to expedite the matter. Drinking, doing drugs, cigarettes are 3 really good ones, not sleeping well at night, involving yourself in risky behavior, and just being stupid about the way you live. Oh. You know, there's certain foods that you know are really not good for you, so you don't load up the truck when it comes time to eat. So not that kind of stuff notwithstanding, what we're going to do is we're going to take it from about the age of 30. Now, this is when most people start to feel the age creeping up on them. This is when professional athletes start to tear themselves up because the ligaments and joints tend to stiffen a little bit. They get a little dehydrated. This is where the rubber hits the road, as it were. So a lot of basketball players, a lot of football players, soccer players really never work too much into their late 30s because they can't tolerate it. It takes twice as long to heal as it did when you're in your teens and early 20s. So that is basically what it works out to. So what do we add to the down to basics, the multivitamin and mineral complex and the fish oil, the essential fatty acids? You start to add things that will deal with the ravages of time. And so it starts with what are the most likely things to begin at that time. Number 1, it's a little early for things like menopause, although it can happen. And we're going to discuss gender differences next week. Men and women are different. So it's just the way it works.
Is Tom Brady not
he's a
real
man.
person?
No, he's a man.
He said he's going to play football till 50. Can he do that?
Yeah,
do you think physically?
Stop him.
Do you think he can do that?
I think he could probably do it. But most of the rest of us mortals can't. I went back and I decided I'd try to take up rugby again. I did 10 seasons semi-pro, and I figured, well, now that I did it when I was 62, I went back and I thought, well, I can go ahead and do this thing. Well, for starters, my cleats were rotted, so that was a problem. But I couldn't make it around the track. I couldn't keep up. And it doesn't really matter. Your attitude, I feel like I'm 18 years old, but the body says no. So Tom Brady notwithstanding, some people just have that type of makeup, but most of us do not. So when you hit the 30s, 30 years of age, we start seeing things like drop-off in testosterone in men. We'll talk about that next week. You'll start seeing drop-off in estrogen with women. We'll talk about that next week. But even more interestingly, beginning at about the age of 18, you start having issues with hardening of the arteries. Now, these studies came out of Vietnam. We had a lot of dead kids come out of Vietnam. And they did autopsies on a good number of them, and what they found was that atherosclerosis, or hardening of the arteries, especially with regards to the heart, began as early as 18 years of age. So it kind of depends upon what you eat and how you take care of yourself as to how you're going to age later on. So as a result of this, well, what do we worry about in a 30-some-odd-year-old person that's working hard? Well, 30-year-olds die of heart attack, and so we do concern ourselves with things like cholesterol, triglycerides, and whatnot, heart health. So what we do is we use something called hyperfolate, which is high-dose folic acid. And this is the least expensive nutraceutical that we have in the entire practice. It's 5 times the prescription strength of folic acid. It's 5,000 micrograms, and it does something very interesting. It reverses plaquing of the arteries. It's the only thing ever been really shown to do this. The second thing is it lowers cholesterol, and it's also a very cheap detox. It's a methylating agent. So I've been taking this dosage of folic acid, hyperfolate, 5,000 mics, for about 20 years. At 67 years of age, my calcium score, hardening of the arteries in my heart, was 0. My dad passed away at 92. Okay, he had one lesion in his heart. He'd been on it for many years also and had full collateralization and excellent ejection fraction. In other words, his heart was that of a young man. $4 a month is pretty cheap. So folic acid, very, very important. In most of the multivitamins that you see out there, the dosage, when you're looking at it, it says 400 micrograms and 500 times the RDA. Recommended daily allowance is actually kind of foolish. It's one of those sorts of benchmarks that made some sense in the 1940s and 50s when they started pulling these numbers out of thin air, and they make even less sense now because vitamins are enzyme cofactors. Once you have enough of them floating around, that's no longer much of an issue. But many of these things have secondary chemical natures to it, like folic acid, which in addition to being an enzyme cofactor is also a methylator, detox, and some other odds and ends. So it has little to do with its RDA and it has a great deal to do with its therapeutic and its pharmacological effect. Second one, okay, that I add at the age of 30 is called N-acetylcysteine, or NAC. And you'll hear me talk about this one a lot. Why? Because it's medical duct tape. NAC to a physician's practice is like duct tape is to a farm boy here in Florida. Okay, it's good for lots of different things, and you don't leave home without it. And acetylcysteine is the most effective and least expensive of all antioxidants. You got people out there that'll spend $100 a month on these vegetable capsules because they're great antioxidants. This stuff is $23 and it's probably 1,000 times more potent. Why else does it work? It's interesting. It's also an antibacterial. It's a gram-negative antibiotic. And then we got a couple more reasons to do this. We'll pick this up after these important announcements, and we're going to get you on your way.
Got to say hi to Alex and Louise. They're listening and watching us on the social media over across the pond in the UK.
Cool.
We always love it when the guys check in from the world across the pond. Hey, I think that's what you call it, right? Across the pond.
Across the pond?
Yeah, something like that. All right, we'll be right back, and we'll be taking your text, 23680. Get on the text line. There's another one popping in. We'll get to it right away. Just stay right there. Stages of Life Radio, News Radio, WFLA, Orlando. Okay, so okay.
Well, speaking of the UK, so we started watching another TV series on, I guess it was either Peacock or it was on, could have been on Netflix, but it's called War of the Worlds, and it takes place in Victorian England. So it's not the George Orwell version, but it's or at least it's not the original version of it by any stretch. But it's actually pretty good. I was looking at this thing thinking, how can this be any different or any more interesting? It turned out to be both. More interesting and different.
What about iron levels? What about K? What vitamins are good for something or other? I guess that's losing weight. Losing weight.
Okay, so where are we on that thing? Question a second.
I know.
Okay, I'm just.
Yeah, Risa.
Okay, so.
Risa Constantine.
What vitamins are good for? Oh, okay. Fry losing weight. That's what happens when you type too quickly. Yeah. So to lose weight, what's kind of interesting is you need to know what is causing the weight gain to begin with. If you're speaking to somebody who's eating because they're bored, okay, the best vitamin you take is something of interest. Okay, it could be work. On the other hand, if you've got somebody that's overweight, they're not eating as much as they think they should be, more than likely they're looking at something called metabolic syndrome X or insulin resistance syndrome, same thing. And the deficiency there is kind of weird. The deficiency is that of chromium and vanadium. So these are neither of these are vitamins. They're both minerals. They sit in the vitamin and mineral aisle, okay, but they're minerals. So vanadium or vanadiol sulfate, the starting dosage is 4 milligrams. You can bump it all the way up to 40. And then chromium starts at about 180 micrograms, and you can take it up to 800. The combination of the two will give you weight loss. To that, you can add berberine. It's very, very useful. And then if the problem is depression, use L-tyrosine, which is an amino acid, not a vitamin.
There you go. All right, of course, we will answer the questions during the very light commercial breaks, which I like.
Oh,
that.
yeah.
I like that, yeah. To lose weight. She's 60. You can do it, Raisa. You can do this. Welcome back to Stages of Life Radio. Look at that top text. Is this Stages of Life text? Yes. 23680, that's a text line. Hey, Linda. Hey, Raisa. Hey, Alex, Luisa, and anybody else who's out there listening. If you want your name on the radio, you know the deal.
Well, I guess if Raisa had a restaurant and she were fluent in Latin, it would be tabula rasa. Not bad, huh?
Not Rasa Ristorante?
Rasa.
Yeah, Rasa.
Yeah, that's funny if you took Latin.
It is. Wow. Okay, no, it is, really.
Yeah, thank you.
Ad infinitum et nauseam. Oh, sorry. Yeah, oh, yeah. See, I do know some Latin.
Quod semonstrandum.
Yeah. Oh, nice. Caveat emptor, my friends. Okay, so anyway, welcome back to the Latin show.
Hickory dickory dock. There we go.
Hey, he needed the
All right, so what have we got next up here? Let me finish up what I was talking about.
Finish up with the nutraceuticals.
All right, yeah. So hyperfolic or high-dose folic acid, the N-acetylcysteine we've already discussed. There are two more things that you would take at middle age. And this is going to answer a little bit to what Reza just asked about, is what can you take to lose weight? Because that actually is one of the first things that happens as you hit the age of 30.
Yeah.
You start to gain 2 to 3 pounds per year.
So she's 3 on top of that. She's 60 now.
60.
3 decades.
Well, God bless you for hitting 60.
Mm-hmm. And it's hard when you are losing weight when you're older. And a lot of times, doctors are encourage people not to lose too much weight, because if they fall down, go boom, they break things.
Well, there's that, but also they don't want the patients to be skinnier than they are.
Well, yeah, there's always that.
What else? Okay, there's one that we use called Diabetstat, which oddly enough, Miss Reza, okay, is a combination of vanadium and chromium. Why is that important? Because you are not alone in that question. So I put that stuff together. I cobbled that one together years ago because it was just the safest and least expensive way to get it done. Because the appropriate chromium that you're looking for is chromium polynicotinate, not the picolinate moiety that's out there. And you have to be very careful with the balance of these things. So Diabetstat, we would go ahead and add to the Down to Basics. The NAC, we add to it, and the hyperfolate. Is there more? Okay. And the last thing is the last piece of this puzzle. Okay, something called taurine. Now, why would you add taurine? The dosage there would be 500 milligrams, 3 to 4 times per day, just making sure that you don't take it at bedtime, take it any other time. And what happens with taurine, which is very, very interesting, is it's protective with regards to kidney function. And the worst thing it's going to do is give you some assistance with regards to that mid-afternoon fatigue. So taurine is an interesting adaptogen. You can use it when you find yourself just in need of some kick in the tail to get through the day. So taurine is much healthier than caffeine, which is my drug of choice, but taurine would be number 2.
Okay.
So next week, what we're going to do is we're going to make recommendations and alterations by gender, then followed by disease states, and then finally seniority.
So there might be 5. Now,
it depends on how fast I talk.
Might be 5 in this series, which is fine, to be honest.
Whatever it takes.
Really, whatever it takes. Now, we've got a bunch of questions lining up here on the text line. Let's go ahead and start with the lady with osteopenia from last week. She says she wants to know what choices do I have to raise my estradiol level from 10.
Well, 10 is pretty decent for somebody that has an untreated estradiol at that age of 71. Where you want it is going to be somewhere between 30 and perhaps as high as 70 or 80. Okay. However, would I be happy for 35 or 40? And the answer is yes. There are 2 ways to do this. There's more than 2, but the 2 that I like to go with is, 1, you can use oral estradiol. It's cheap, it's easy, but it tends to goof the liver up a little bit. The dosage would be a 0.5 milligram at bedtime to 1 milligram at bedtime, but you do have to be careful because if you don't bring the progesterone level up with it, you can start having hot flashes. The second way to do it, and this is my preferred way, and that's to go transdermally with a cream that you would use if you're sleeping with a man. Okay, at 71, there's every bit as likelihood that you're sleeping alone. Okay, then taking the estrogen cream at night is not a bad thing. But if the sheets happen to hit a guy, that estrogen can be problematic. It'll cause the prostate to enlarge, and then they start getting up to pee, and they have other issues of intimacy, which, by the way, even at the age of 71, you should be able to handle. So transdermal estrogen, I prefer to use it in an MSM base. And then you apply that to the inner aspect of your forearms, and you do that at bedtime. But if you're sleeping with a guy or a guy's in your bed with you, for whatever reason, then you do it in the morning.
Hey, Barb, thank you for checking in.
Those are the choices.
Watching us on Facebook on our Stages of Life Medical Institute page. Says she's enjoying the show.
Cool.
Thank you. Got a question about the jabs. Booster dose of Pfizer approved for 65 and older, but I got Moderna. Is it safe to get the Pfizer booster if you got Moderna for the first or second jab?
And the answer is affirmative. It's not that big a deal. My preference, is to get the same one. Okay. However, it doesn't make a great deal of difference. And the fact that it's approved doesn't mean that you can't go get it. It just simply means that the FDA suggested, that you start with a 65 and older. But also, oddly enough, those of us that are in the healthcare industry that are not 65 years of age. So if it sounds like an age issue, it's really an availability issue. It has nothing to do with anything more than the World Health Organization chiming in, telling us that we should be ashamed of ourselves for taking care of our people, the ones that paid for it. Don't take care of our people when there are all these folks around the world that hate us but really want us to give them our medicine. And so as long as we have a World Health Organization that continues to suck money from us and give us such marvelous disrespect, then we're going to hear those sorts of bits of nonsense. So it was the FDA caving to the World Health Organization because, after all, that's what we do best here.
Again. Racist said you used to have a product called Gut Integrity.
Yes, actually we still do. We just simply renamed it. And so the Gut Integrity is a colostrum product, believe it or not. And so that's not so much for osteoporosis, but it's for things where people end up with, let's just say that they have leaky gut syndrome, or they have problems like ulcerative colitis, or they have problems like Crohn's disease. Then you would use the Gut Integrity. And what it does is it kind of beefs up the tight junctions that hold the gut together, but it really doesn't do squat for the osteoporosis. Now, the estrogen, you got to take care of. That's something that you have got to do. If you do the colostrum, and we're going to get into the disease states, pretty much after next week, it'll be the week following. Okay. We're going to talk about colostrum because not only does it assist your gut, but it helps with regards to sleep, increases growth hormone levels, It improves REM sleep, which is kind of neat. So there are a whole bunch of things. Each one of these medicines that I'm talking about may be over the counter, but each one has multiple benefits, and you need to understand how that fits into your life, because what may be of benefit to you may not be of benefit to somebody else. What may be a benefit to you may be a detriment to somebody else. You know, if you've got somebody that has some bizarre kind of narcolepsy, giving them something to make them sleepy may not really be a good idea,
Probably
don't you think?
Great, yeah.
You know, so you just have to be aware that every medicine you take has 10 unintended consequences. If you know what those consequences could be and they're beneficial, then you know what you need to do.
Most definitely. Okay, text line 23680 or 23680, whichever you prefer. Here's a text in, says, quick question. I've seen the doctor before. Said my adrenal glands are not producing any hormones. Put me on
DHEA, dihydroepiandrosterone, yes.
Recently, my digestive doctor did a CT scan looking at my colon. They found a 2-centimeter mass, non-specific on my adrenal gland. Now they want to do an MRI. Any idea what it could be?
Yeah, generally it's just a cyst. So what will happen, especially if you've lived in the Midwest or in places like Pennsylvania and whatnot, there's something called histoplasmosis. And you can end up with these bizarre cysts on the kidneys, adrenals, and liver in particular. And, you know, is it a big deal? The answer is no.
Didn't they call it, I have one of those, and they call it incidentaloma.
Incidentaloma. It's kind of a funny way of putting it.
I mean,
but it's
don't mean
a 2-centimeter mass, okay, like that in an adrenal gland. But, you know, sometimes you'll see things like tuberculosis.
Right.
Once in a great while, you'll find an adenocarcinoma.
So let them go ahead and
do
the MRI.
Yeah, do the MRI, because it's not going to hurt to do it. But do I expect anything to come from it? The answer is no. DHEA is the most prevalent hormone in your body. There's more DHEA floating around than every other hormone you have combined. So when somebody comes back, well, I don't know what that does, I don't want you to take it, that's really kind of dumb. Yeah. Your body uses it to create well over 100 different adrenal hormones. 2 include cortisol, testosterone, estradiol, estradiol, progesterone, androstenedione,
Well, look,
and
his
a lot
doctor
more.
didn't take him off of it. He just said he found that mass while he was
Well, it's a good
having
thing.
CAT scan.
Yeah,
or
I mean,
CT scan. I mean,
you know, one of the funny things about scans is you always find something abnormal. If you've got any age on you at all,
Scan.
it's like buying a used car. If you can't find a scratch, you know that thing's been repainted.
Yeah, no way. Okay, Alex has a question from
Sure,
in
Alex.
the UK. He says he's in the London, Victoria
Okay.
area. He says his Nana got pneumonia. What's the best way to keep her going and her breathing? She's 86, and she promised to take me on a helicopter ride next year.
Okay, pneumonia, interesting problem.
It's a little selfish, but I like it, Alex. Good,
You know,
good question.
First thing I would do would be to use N-acetylcysteine. Now, NAC, oddly enough, is a first-line antibiotic in the UK to treat bacterial bronchitis. So, can you get N-acetylcysteine or NAC? And the answer is yes. I just don't know how. You know, we've had to ship that to people in the UK because nothing, is easy any longer. But NAC is a marvelous way to do it. The second thing you take is guaifenesin. Now, guaifenesin, when used with the N-acetylcysteine, will help her bring the junk out of her lungs. And with these two things together, you drink lots and lots of water.
So do you get this at a hospital or do you get this at a pharmacy? How's he going to...
You can get it at a health food store in this country.
Okay, yeah, but he's in the UK.
Well, I don't know. So I've never been to a health store in the UK.
Nor have I.
I have been to lots of museums.
I've actually never been to the
pubs
UK.
in the UK.
Alex, someday I'm going to go and hang out with you.
In the
but
UK?
Today is not the day.
Oh yeah, warm beer. It's different.
Oh yeah, wasn't it warm and got yeast
Warm
floating
beer,
in it?
warm beer is fine, but the darts. You know, the problem is that the darts don't hit the board the more drink, the more beer you have.
If it ain't still, it ain't real.
Yeah, that's the answer. There you go.
All right, here's the deal. We're going to take a quick break. Give us a little bit. Call us. Text us. Phone lines are open. 407-422-1212. And the text line, as I said, is 23680. And we've got questions already lining up. Stages of Life Radio. So she's taking steroid tablets to help her?
Yeah, well, that's typical.
That is typical.
But it doesn't necessarily help. And the reason I say that is she'll start to breathe a little bit better, but it tends to shut down the adrenal secretion of cortisol. She'll be doing a whole lot better if they'd used Cortef instead of prednisone.
What about a Z-Pack or something?
Z-Pack, not so much. The antibiotics, it really depends. You have to look at the patient to see. If she's having fevers and chills, then zithromycin works just fine. But more times than not, these sorts of viral pneumonia-type pictures, you give people antibiotics, and it makes them sicker.
Ew.
So you got to be real careful. And I'm not a big steroid proponent, but when I do use steroids, I prefer to use hydrocortisone, or Cortef is the brand. What do we got?
I'm trying to do math.
Math.
Math. No one said it would be math.
Can you subtract that from 60?
Yes.
There we go.
Did I do it? 38. 38. Oh my goodness.
60 minus the time of the spot.
You know it's how I have to do. I can count backwards from 60, sometimes even 120, 180. Don't push it further. But yeah. Okay, what else we got? Do you believe that antivirals can help you from getting sick from COVID?
Well, there's some truth to that.
It's been suggested not to get a vaccine.
That's nonsense.
Nah,
not so much. Okay, so here's where you need to just talk to yourself in the mirror and hear what you have to say. So taking an antiviral to prevent COVID makes about as much sense as discharging a fire extinguisher to prevent a fire. It doesn't work. Does not work that way. So if you end up with an infection, okay, the antivirals may save your life, or they may not. And in fact, a lot of people are dying in this country that have received all manners of antibiotics. You can rest assured that people dying in the hospital of COVID have had their arms filled with remdesivir or something similar.
Too late.
So the trick, okay, is to prevent rather than to have to chase yourself. So if you're not getting a vaccine, you're putting yourself and your life at risk.
Why do you think they turned around on Regeneron and stopped talking about the third booster?
It's a good question. That's probably World Health Organization and cost. Yeah.
Positioning.
Yeah. Money.
They want to have it.
Money.
They want to have it.
Yeah.
They need to have it.
Money.
I want to run it.
Right.
It's mine.
There you go.
Welcome back to Stages of Life. Nothing gets past us here. Let me tell you what. Wow, we're so smart.
But 95% of physicians in this country, I can't speak to the UK, but 95% here have been inoculated.
I just want to say, who's that one dentist? You know the one.
Yeah.
4 out of 5.
When they say 4 out of 5 physicians smoke Chesterfield cigarettes.
I remember that, yeah.
So not all your advertisements are real.
No. Okay, so we've got some questions to answer. The phone is lighting up at 407-422-1212. See, not everybody watches football on Sunday. Some people actually pay attention.
They want to learn something.
And they want to learn about health. This gal, I'm guessing here that it's a gal. But she's 67.
Well, she's asking about birth control pills?
No, getting hot flashes.
Oh, there you go. Well, guys can have hot flashes,
I know,
too.
but she says, why am I still? And I'm thinking,
How old is she?
67.
Okay, why? Because you still have...
still in menopause.
You're still in... Well, not necessarily still in menopause. You're going to be postmenopausal. But the hot flashes come from something called estrogen dominance. So if you think about a ratio, and the ratio is E over P, okay? Any number over 0 is an infinitely high number. So you can have just a little bit of estrogen, but if you have no progesterone, that ratio is extraordinarily high. That will result in hot flashes. Or let's say that your doctor went ahead and started you on estriol or estradiol cream or tablets, because after all, you have osteoporosis, we need to do that. Without giving progesterone in proper amounts, you're going to end up with hot flashes. That's just kind of the way it goes. So what that means is that you're just a little bit out of balance. So if you had an 8-cylinder car and one of the spark plugs wasn't working, it would misfire. So what you're doing is you're missing one very important hormone, and that hormone is called progesterone. That's why you're having hot flashes.
Okay.
Not a bad problem to have.
It's an
easy problem to fix.
Let's see.
Fixing it 100%, though, is tough. I got to tell you. What you can do is knock it down substantially, but it's very, very hard to get the last little bit of that to fix, because the progesterone that we use does not last 24 hours.
Oh, I see. Now, I know that this is... when will my royal Pincietta tree turn orange?
It's a good question.
I have no answer for that.
Yeah, when the swallows return to Capistrano? I don't know.
Is that right?
I don't. When should I start my potatoes this year in Ocala? Look around. There are a lot of potatoes in Ocala.
A lot of potatoes in Ocala.
Yeah.
But a papka is actually isn't it? No, the potato.
A papka?
A papka is actually a word that means potato. Did
Okay.
you know that? All right, 40. It's true. Look it up.
I thought it meant near Orlando.
No, it means wild. I don't know. It means potato.
It's Seminole for near Orlando.
No. We used to do that too.
Yeah, I know.
Where I'm from, yeah. It's called Novadear. What's that mean? It's Indian for the airport. You people are so... 23680, give us a check-in. Let's see. A papka means it's coming in. Yes.
Here it goes. Linda's doing it.
You're waiting.
Come on, Linda.
A papka.
We're waiting for you.
For Linda. Big potato.
The big potato.
See? I win. Was there anything on the table for that?
One day I'll tell you the story about the fellow who just couldn't be attracted. You know, the women were never attracted to him, but he fixed it with a potato.
I don't want to know anymore. I really don't. Okay, so earlier we were talking about nutrition. That could have gone really south.
So in any event, so that the deal here and the take-home message, and then we'll continue to take messages from the Ausland, okay, is that your body needs certain pieces of material, certain chemicals, certain building blocks, certain moieties, chemical substances in order to complete the picture. So if you were trying to make, let's say, a book and you didn't have any glue for the binding, it wouldn't matter how good your printing is, how good the paper was, it wouldn't hold together. If you ended up with something that required a staple or two, or glue, or if you had to paint your walls in order to finish the job, the last thing that you need is the one that you might be missing. So in this case, these are certain nutritional substances that the body cannot produce on its own, and they may not be present in our food supply. So where do you get folic acid? From foliage, FOL. Okay, you get it from leafy vegetables. Do you know how much spinach you have to eat in order to get 5,000 micrograms of folic acid? Yeah, probably about $30 worth of spinach, and you would be pooping black by the time you did it. You have no room for anything else in there.
Yeah.
N-acetylcysteine is not necessarily something you're going to get in your diet at all. Taurine, you can, but you'll never get enough in your entire lifetime.
So NAC, now you've mentioned that several different ways time Sunday today.
Yeah.
Is that an over-the-counter?
It's over-the-counter.
Is it NAC when you find it on the counter?
Oh, it could be listed as N-acetylcysteine, sometimes just acetylcysteine,
okay,
or it could be there as NAC. What's it all about? It used to be a prescription item. Mm-hmm. And then it went over the counter. It went over the counter. The doctor stopped prescribing it because, after all, we all know that when things go over the counter, they stop working. When they go out of patent, they stop getting promoted. Consequently, many of the doctors never hear about it. NAC has been around for a long time.
Yeah.
Guaifenesin is another one. Guaifenesin, Robitussin is the brand that's generally out there, was originally developed as a muscle relaxant, but it's a great expectorant. But it does a bunch of other cool things. So just like a screwdriver, okay, now what does a screwdriver do? Most people will use a screwdriver for just about anything in their house except for driving screws.
That's not true.
Oh, absolutely.
I've only picked my ear with it once.
Yeah, you'll do that, but you'll be using it as a chisel. You'll be using it as a weapon. You'll be using it to open boxes, paint cans. It's used to do lots etching, onto other surfaces if you want to ruin somebody else's paint job. It does a lot of things. So a screwdriver is a very useful tool, but not 100% used to drive in screws.
Okay.
So that's just the way these things are also. So NAC, okay, I use NAC, which is marvelous for many different problems. But when you have autoimmune thyroid disease, it is an essential piece of that. When you have diabetes, it's essential because NAC not only does what it does to the sinuses and drains them. You have allergies. Not only does it help when you have to bring up sputum, crud from your lungs, but it also helps with regards to the free radical scavenging effect in the thyroid. It's marvelous stuff with regards to the insulin receptor. So if you're going to bring somebody's insulin level down and bring their blood sugar down with it, NAC is something you have to use with a diabetic.
Well, it makes perfect sense.
Yeah. And so, but each of these pieces, again, the context that we're discussing it here really is much more general terms. But we're going to get into the disease management issue in 2 weeks. Next week, it'll be gender, followed by disease state. After that, it'll be age. How do you keep your machine going? Well, the machine can go, but the brain stops. That's not such a happy ending.
Yeah. Rick is on the phone. Rick?
Sure, Rick. What you got?
How you doing, Rick?
Hello?
Hello, Rick.
Yeah,
Rick.
you there?
Yeah.
Yes.
No, we left.
What's up, Rick?
All right. I spoke to you, it's a little complicated. A few months ago in June I took too big a bite of sandwich and I had a pain in the esophagus very briefly, and I still feel occasional twinge. I was told in 1996 I had a hiatal hernia, and I read about Schatzky's.
Yeah,
but I noticed when I sit up straight, I don't feel it.
Okay.
Because, I read that if you sit slouched, you can sometimes feel the food go down.
Okay. Well, here's the
took
deal. Here's the deal with the Schatzky's ring. Okay. So what that is, it's a bit of scar tissue that kind of diminishes the caliber of the esophagus, and the food can get stuck there. But it's down fairly low. The Schatzki's rings are not up high, but there are things that will do what you're saying. So when you end up with esophagitis, and you end up with a Schatzki's ring, you'll actually feel more comfortable slouching forward. If you're leaning back and it feels better, it sounds far more like having what's called a pulsion diverticulum or a pharyngeal cyst. So a pharyngeal cleft cyst is fairly unusual, but it's an outpocket of the esophagus. And so when you're in certain positions, it'll open, certain positions, it'll close. And but pharyngeal cleft cysts, but also pulsion diverticular, thyroglossal duct cyst will do it too. So these are unusual, but you do see them from time to time. You'll swallow something, thyroglossal duct cyst is notorious for this kind of a thing. A little tiny bit of food gets kind of stuck in there, and you just can't clear it, and so that really sounds more like it. You go to extend, and it closes that little hole, and you might feel a bit better. So I would have your doc, if they can do it, to do something called an esophagoscopy. And what they'll do is they'll go down, get a look. The second thing you do is you do a barium swallow or some type of radio opaque substance, so you can look and see where the stuff is going to. But you pick up these diverticula from time to time. Meckel's diverticulum can mimic this problem as well, although it's fairly common. It tends to cause epigastric or stomach pain. We see those about 3 or 4 times a year.
Barb is watching us on Facebook. Hi, Barb.
Hey, Barb.
We're waving. She says NAC is great for the thyroid, but
Yes.
how much for hypothyroid?
Okay, it depends on what's causing it. So if you have Hashimoto's generally causes low thyroid function.
Yeah.
So Hashimoto's can give you a little bit of a stir. It can cause intermittent hyperthyroidism, but it's rare. It's a little unusual later on in the course of the disease, but it will tend to burn itself out. So it burns. Your thyroid function tends to equilibrate kind of sort of. You still feel like crud. Your weight goes up. N-acetylcysteine is very helpful under these circumstances. So the way you take it is 500 milligrams 3 to 4 times per day and see what your thyroid function looks like, but more so see how you feel. And, if you're having sore throats with the thyroiditis, as many people do, see if it settles it down, because it very, very commonly does. It's worth a try. It's cheap.
Yeah, it is, and it is definitely worth a try.
Yeah.
This is Stages of Life Radio. Anything that we talk about, whether it comes to nutraceuticals or otherwise, can be found on stagesoflifevitamins.com. Better bet, though, is to go to stagesoflifemedicalinstitute.com. It's kind of a landing page for radio and all things scientific, because Doc's got so much. He just blew all over the internet right there. Just
Yeah, well, the data gets puked out, as they say.
Yeah, that's true.
So, there are lots of videos, lots and lots of audio files on there. They're not sales pitches.
Good
what they
information.
do is they teach you what you need to know.
Free information.
Free info.
And it's not WebMD, so you can kind of
There's a real MD
yeah,
behind
right?
it. Yeah.
Whee! We'll be right back. It's not WebMD. Thanks, Barb. Thanks, everyone, for watching and for helping us out on the on Facebook. Ian checked in. He said, yeah, I'm right, that the word is an Indian word, something to do with Seminoles and a place where they went to eat potatoes, which is actually, yes.
Near Orlando.
Outside of Orlando.
I was that.
I'm telling you, we used to say that on the island. People ask, because we had Nobadir, we got Wawinit, and things like that. And tourists would come in, and they'd be like, what does that word mean? Like, oh, village near the airport. And they're like, stop for a second. You just kind of, where's the causeway?
Where's the causeway? Yeah.
Just keep walking that way till your hat floats. It's like
there's barge.
Age-old answer that still hear.
My former wife was convinced there's a tunnel from Miami to Key West. Honestly.
Wow.
Yeah, she's missing a piece.
Just a little bit.
We were driving down the way. I'm saying, hey dear, there is no tunnel.
Really no
There's
tunnel.
a long bridge.
Let me just clarify.
There's
Florida's a peninsula. Really can't do the tunnel thing. Not really well.
No.
Although my grandfather was convinced that we got our fresh water piped in from Canada on the island. So, yeah.
Oh. Yeah. Okay. Yeah.
Then what's that filtration plant for? Yeah, you're 10. Shut up. No.
Yeah, we just in the Klein household, we just had to replace our water system.
What?
Yeah, well, it's 20 years old, and it just kind of gave up the ghost. And all of a sudden, everything started to smell like sulfur again. It's maybe it's time.
Yeah, I once opened up a pipe. Stood there when someone cut through a pipe.
That's
plumber,
bad. Yeah.
And saw the greenish globy globble.
Yeah, you're not supposed to look.
You should really never see that.
Yeah. No, that's why you pay them the big bucks.
That's why I bought bottled water for years after that.
You don't want to see it. So. But so the water is actually kind of interesting. So we send ours through several filters in several different stages before we consume it.
An aquifer.
Yeah, and it's kind of explained why my teeth have rotted away. It's probably all that fluoride I'm not getting. I don't know.
Who knows? It could be. Where are we at? Oh, almost time for us to come back, and we got a couple of questions on the text line. Who knows if I hung up on Rick or not? He's probably still hanging on. What, doctor?
Poor guy.
He calls you every week. He loves you.
He's a good guy.
He's a good guy. Look, we're back. I don't know why that didn't start, but we are back.
Well, it's a good thing we weren't saying nasty things about our
but I know, right? The song that was in there was Nasty Boys, so now I got to get rid of that.
Nasty Boys.
Yeah, hold on. I must do that. Welcome back to Stages of Life Medical Institute's show. It's called Stages of Life Radio. There we go.
All right, so we got a couple good questions coming up, not as opposed to the ones we've already had. And Melissa?
Yeah, I'm here.
Are we on now?
We are. I was trying to get rid of that.
Yeah, I'm trying to figure it out.
We're fine. We're on.
The board is confusing to me.
Oh, things confuse you? What,
Well,
all
only
these
that.
buttons and stuff that I play with?
Well,
Yeah.
no, just that when I play with them, nothing ever works.
Yeah, I know, right? I've heard that. Okay, here's a question from a healthy adult woman in her 60s. What are the differences between folic acid and methylfolate?
Expense. Methylfolate is a patentable product. So when they develop methylfolate,
It's got goodies in
it's
it.
expensive. It's $30-$40 a month, whereas folic acid itself is one-tenth the amount.
$12.
Yeah, it's what's found in nature.
Yeah.
Methylfolate is not. And so what happens is you really can't fool Mother Nature. It kind of works that way. So we measure folic acid levels in the bloodstream.
The question
We can
goes on,
see
though.
what's going on.
It says, apparently she's looking for some healthy tissue and quick recovery.
Folic acid is not going to help you with that from
I was
exercise.
just going to say, that's not where you're at there.
No, there's far more. It's far more interesting than that. So when you're looking at rebuilding broken down tissue, you have to use it all. There's no singular choice. Well, I'm going to take B12. No, you're not. What you have to do is you have to take the appropriate mixture of amino acids, the appropriate mixture of fatty acids, the appropriate mixture of carbohydrates. Then the vitamins and minerals become very, very important. So when somebody goes through surgery, their caloric need may double or triple. So you say, well, I only need 1,100 calories a day. You may need 3,000 to 4,000 per day following abdominal surgery, in spite of the fact that you're in bed laid up. The same thing is true with nutrients. The need for these things goes up, it doesn't go down. So the question then becomes, why don't we do this post-surgically in the hospital? And the answer is, I don't know.
Yeah.
I did that for a living, and you could not convince the surgeons that nutrition was an important thing to be concerned with.
Still, it doesn't. It's ranked a little higher now, but still
not much. So you have to do this
farms.
yourself. So how do you recover for exercise? Now, when I have professional athletes ask me that question, it means something different. So how do you make the muscles hurt less and actually get stronger? And the answer, the combination that you might be looking for, I'm just assuming for a moment there that you're not, but we use alpha-lipoic acid and acetyl L-carnitine. That combination is what I use for athletes. That is a wickedly cool thing, and you do it before you exercise and you do it after you exercise. You do it before your marathon, you do it after your marathon, or if you're just doing a 5K or whatever. That's the way you do it. Or I was a fighter. I did full contact karate. I didn't do it well, just so you know. However, I did it for a couple of years and made it. I didn't croak. These are the sorts of things you did then. So acetyl L plus ALA.
Yeah, the one thing I would say avoiding, and I don't know what part of the body that you're trying to recover from. Make sure you
depends
don't.
on where you're kicked.
Yeah,
in karate.
really. But make sure you're not using something that numbs the area.
Like the old racehorse thing. So you end up putting a lidocaine patch on a joint that's torn up. That is not a good way to go. But you can use anti-inflammatories. So I use something called Kinkies, which is a topical MSM. And you put that on the joint, it feels better in about 20 minutes or less. Does it cause any damage? The answer is no. Does it encourage you to damage it further? The answer is no. But it does encourage you to rest.
Yeah.
So Kinkies works well. It's cheap. You put a pump or two on the joint. 3 or 4 times a day, and it takes care of it.
So I would suggest that, and you can find Kinkies at stagesoflifevitamins.com. I actually
developed
use it
for
all the
horses.
time. Well, I use it for my hands.
I developed it for racehorses, as it turns out. Initially, when I first came up with that stuff, it was for my daughter's quarter horse because she was out there competing.
No.
So if the horse tore into a hock or a fetlock or a wither, whatever happened to be, and started to limp a little bit, well, then she wouldn't end up doing well in the competition.
Of course not.
So this stuff goes through horsehide. So I used to find, which was weird, so I developed it for the horses, and then it started disappearing from the stables. And we found that these Central American horse handlers, the guys that were out there grooming and whatnot, were taking it for their elbows, knees, and shoulders. And so it's like, well, okay,
Perfect.
clown, if it's good for the horses, why not use it on people?
Linda can't live without my Kinkies either. She's watching us on Facebook. Let's see. Text line 23680, winding down, by the way. So if you've got a question, you better get to it. 23680 against the text line. Here's one that I'm going to try and decipher.
Yeah, there you go.
Should I take NAC and
Guaifenesin.
Okay, Guaifenesin for COPD, even if I'm already taking
levothyroxine. So it's the same kind of thyroid as so many people take.
Mm-hmm.
And the answer is sure. N-acetylcysteine and guaifenesin will help you clear the lungs out. The NAC is very, very helpful if you have diabetes and or hypothyroidism. So the answer is absolutely.
Sure.
The guaifenesin isn't going to do you much good with the hypothyroidism in particular. But one thing about being hypothyroid is your face gets puffy. The sinuses also become more easily congested. So sinus issues like that are far more common in folks with hypothyroidism. So one of the physical findings you'll see with chronic hypothyroidism are, the individual's face looks like it's been slapped. It's edematous. It's round. It's blunted. The features aren't sharp. So what does it look like when somebody has maxillary sinus issues? The same thing. Same thing. So it's helpful, but not to treat the disease, but to treat the sequelae or the consequences.
So niacin and guaifenesin could...
Guaifenesin and N-acetylcysteine, yes.
I got that. That was.
There we go.
I really
That's
did not make
Those
my
are
way
tough.
through. They are tough. Oh, thanks. I
You're getting
appreciate
better,
that.
though.
I know, but I can't do everything. Alex and Louise, you still watching over there on the other side of the pond? They said that you can get the booster shot whether you're 18 years or older now.
Good.
For that. Well, yeah, 15 to 18 can have the boosters as well as all shots. So.
Excellent. Well, as it should be here. So what we do for our patients at stages is I'll write people a letter. We'll get antibody levels. Now, this is what I'm going to recommend that you do in the UK, but they'll probably not do it. But that's to get a level, a quantitative amount of the COVID antibody, the IgG. When that antibody exceeds about 6, okay, you're very likely to get sick when you get the booster.
Yeah, if you got too much already,
you got too much antibody, it's going to make for a long day. Now, does it do any damage? No, you'll just know that you're going to have a bad day. So how would I know that? It's called the Florida Man experiment. Hold my beer and watch this.
By himself.
Yeah. So in any event, my lovely wife, her antibody level went to Zippo. We both got COVID and got the inoculations at the same time. My level was at 12. Hers was negligible. She got the COVID vaccine. So did I. Mine was 12, mind you, and I had a 30-hour beating.
Stinkfest.
Oh, it was awful.
Yeah,
it was bad. Okay, now, was it dangerous? No. Was it uncomfortable? Yes. I got the vaccine on a Friday knowing full well there's a chance I'd have a bad Saturday.
Plan ahead, man.
But I couldn't have a bad Sunday, mind you.
Nope.
It worked out perfectly for me. My sister, ended up with a bad day. My brother-in-law, no. So there's some people will end up having a reaction to it. The reaction is typical, which is you feel like you've been beaten up.
In the last minute that we have left, there was a question this week of our president who had a cough, a persistent cough when certain things come up when he's doing speeching.
Sure.
I think it's pertussis.
Well, it could be, but it could also be reflux esophagitis causing vocal cord edema. So the guy, he's probably suffering from the same stuff that you and I have, which is called reflux esophagitis, and it causes that type of nervous cough.
See, there you go. It's a nervous cough. I knew it.
But pertussis,
Yeah.
you see a cough where you want to puke.
Oh, those are different. Hey, we're out of here for today. This doctor's always available, though, at Stages of Life, medicalinstitute.com, and always accepting new patients. See you next week. Bye-bye.
See you guys then.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood, near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts many insurances and Medicare, too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.